Aspergillus is a very common fungus that is found in many people's homes. Its spores are present in the air we breathe, but do not normally cause illness. Aspergillosis is caused by breathing in small spores of Aspergillus. Most people's immune systems will quickly isolate and destroy the mold before it can spread to their lungs. However, a person with damaged lungs or weakened immune systems is more likely to develop aspergillosis after breathing in Aspergillus spores. It usually affects the respiratory system, so your windpipe, sinuses, and lungs, but it can spread anywhere in the body. Aspergillosis isn't contagious and can't be passed between people or animals. Depending on a number of factors, the symptoms of aspergillosis can vary in severity from mild wheezing to coughing up blood. Antibodies are small proteins that circulate in the bloodstream. They're part of the immune system and are sometimes called immunoglobulins. Examples include immunoglobulins E and G. They're made by a type of cell in the body called lymphocytes. Antibodies attach to proteins and other chemicals in the body, which they recognize to be foreign, so not normally found in the body. Various antibodies can be detected and measured in blood samples, and sometimes in other samples such as saliva. The results of some antibody tests are thought to be diagnostic for a particular illness. This means that if you test positive for a particular antibody, this proves that you have a certain condition. However, sometimes a positive test means it is not certain, but much more likely you have a particular illness. Antibody tests can be done for various reasons. With aspergillosis, a blood sample may be taken and sent to the laboratory to analyze whether antibodies to Aspergillus are present in the blood or in a tissue fluid. This test may also be called an Aspergillus precipitate test. A positive result means that antibodies to the fungus have been detected. Examples of Aspergillus antibodies include Aspergillus-specific IgE and IgG. A positive test result is a useful indicator for the diagnosis of the disease and for later comparison to test the efficiency of treatment. However, false positives do occur, as all people are exposed to Aspergillus in the air that they breathe. For example, in antibody testing, a sample of your blood is taken. This blood is then tested for antibodies. These antibodies include IgE, which is used primarily to identify allergic forms of aspergillosis, and IgG, which is used primarily to identify infectious forms of aspergillosis. In summary, exposure to Aspergillus can lead to a group of diseases collectively known as aspergillosis. Damaged lungs and weakened immune system make you more vulnerable to Aspergillus infection. Antibodies help to defend against infection. These attach to harmful substances not normally found in the body, such as bacteria and viruses. These antibodies can be detected in blood samples. Aspergillus-specific antibodies are used for diagnosis and to monitor response to treatment. Important Aspergillus-specific antibodies include IgE and IgG. IgE is primarily used to identify allergic forms of aspergillosis. IgG is used primarily to diagnose infectious forms of aspergillosis. And the rise and fall of these antibody levels can signify the success or failure of treatment.